I was asked a question about hamstring tightness and stretching. So someone was saying that their hamstrings are always feeling tight and they want to know what to do to make them feel looser. And then I think the follow-up question was also for hip flexors, so same sort of thing. The first thing I want to say is that your hamstrings and your hip flexors are not tight. It's very, very unlikely that they're actually in a shortened or tightened position. Most likely what it is it's just a perception of stretch or perception of threat from your body because that muscle is not used to going into a lengthened position. So it's not that it can't get there. The muscle itself can get there. It's more your nervous system either physically preventing the movement with muscle tone or making you feel uncomfortable so that you stop the movement. And really it's just because it's not used to getting into that position. More than likely it's because the majority of the time you're spending either sitting, standing, walking, the activities of your day with that muscle in a shortened position. What I liken it to is if you have a sling or a cast that holds your arm in this position, when you take that off, your biceps muscle is not going to want to straighten out, okay? The muscle itself hasn't actually grown shorter. It hasn't shrunk in any measurable way, but it hasn't been in that position for so long that when it starts going into that position, it starts sending signals to your brain saying, whoa, whoa, what is this? I think there's a problem here, and it's a perception of threat, at which point you're uncomfortable or, the reflex mechanism sends information back down to the muscle that prevents further stretch. So you'll get like increased tone or perception of tone, okay? So more than likely, if you are feeling tightness in your hamstrings or your hip flexors, it's because you're spending a good portion of your day in a seated position, whether that's at an office or a desk, or it could be because you're even sitting like this for too long period of time. A lot of people, when they're standing with their bum tucked under. So if you are, I'm gonna super exaggerate it, but even a little bit of a bum tuck under in this position. So that's gonna shorten the length of that hamstring from where it goes here to where it goes past my knee. Whereas if we're in a more neutral or anterior tilted position, that's gonna increase the length of that hamstring and it's not gonna be held in a shortened position, okay? So that's the first thing. The second thing is that even if your muscle was physically shorter, which is super rare, it's like basically never happens, it would take 4 to 6 weeks of consistent strengthening to change the muscle in length. What recent research shows us is that muscles grow in length the same way they grow in bulk or girth or hypertrophy. So if you're thinking, people are used to that, right? They do some kind of weight training program for strengthening, and they're used to that 4 to 6 weeks, depending on your intensity, sometimes longer, sometimes looking at 8 weeks, for training effects where your muscles grow bigger or hypertrophy. Research has shown us that that's how muscles lengthen as well. So rather than growing in girth or bulk, they grow in length by adding muscle cells, and it takes that amount of time. So for regular daily stretching, 4 to 6 weeks duration, you may find an actual true change in your muscle's length. But what I'm going to say to you is you're unlikely to need to do that. What you need to do is change your body's perception of that stretch and perception of threat so that you are sort of teaching your body, hey, this muscle is long enough to go into this position. It's fine to go into this position. Nothing bad is going to happen if we go into this position, okay? The second point is that other research has shown that even with consistent stretching, the perception of stretch never really changes. So they looked at gymnasts that can basically bend forward and touch their hands to the floor, and they will say, my hamstrings feel tight. Now, clearly those muscles are not short and they aren't actually tight, but that perception is still there because of some other mechanism neuromuscularly where they're feeling that muscle is shortened. But what they found is what does help that perception of tightness is strengthening. So there's a good chance that if you do some strengthening of whatever muscle is feeling tight or short to you, you're going to reduce that perception of stretch. So I'll show you a couple of hamstring strengthening exercises, and then if you have any questions, we can go over specifics. But when I am getting people to do stretch to reduce their perception of stretch and just be able to get more motion, I prefer to do dynamic or active stretches, which means that you're moving through the range and you're actively moving that muscle into position rather than statically stretching it. And then I like to add in ballistics. And the reason I add in ballistics is because when you're moving that quickly, you're more likely to get to your end range. And you're also, it reduces your perception of stretch because there's so many other things going on, it almost confuses your nervous system, okay? The third thing you can do to reduce your perception of stretch is you can do a little bit of self-massage. You can do some foam rolling. Now, I'm not a huge advocate of foam rolling because studies show it doesn't make a long-term difference. So I tell people, why are you wasting your time on this, right? Like, what's gonna make a long-term difference? Probably strengthening, probably active and dynamic activities. But on the other hand, it's kind of like a massage. If it feels good, great, do it. Because if it's gonna feel good or reduce your perception of stretch to the point where you're able to move farther, great, maybe it is worth your time. But don't be fooled that using a foam roller or anything like that is going to break up fascia. Research shows that's not true. And it's not actually going to, you know, like iron out your muscles so now all of a sudden it's longer and you can, you know, get further with it. The only reason you'll get further is because it's going to reduce your perception of stretch. It's just tricking your body. Kind of like if we bump our funny bone on something and it hurts and we kind of rub it, and that rubbing like distracts our brain and takes that sensation away. It's a similar mechanism, okay? But if that helps you, like if doing some hamstring rolls on a foam roller, if you do a little bit of this and then you find, hey, now I can do those exercises and I can get further with it, great, it's a distraction. Use it if you need to, okay? But it's not a must and it's not gonna be the be all and end all, okay? So first I wanna talk about static stretches. So a static stretch is anything that you hold. So when they did these static stretching studies where they actually showed a true change in muscle length after 4 to 6 weeks, they looked at different duration of stretching. And some studies found that it was 30 seconds once a day that was the magic number. Others found it was 60 seconds once a day that was a magic number, and that could be any combination. So you could hold 60 seconds once, 30 seconds twice, 15 seconds 4 times, it didn't matter, as long as your total duration was 60. It seemed to be some kind of magic number. But a static stretch, if you choose to do it because you like it, but remember, this is not going to make a world of difference, you want to make sure that you're sitting high up on your sit bone. So your sit bone is right down here at the bottom of your bum. You want to be high up on that with your knees straight, and you want to lean forward from your chest. You're driving forward from your chest, okay? When you get there, if you want, you can do a little bit of toe tapping and kind of get some nerve stretching action as well as your hamstring. But what so many people I see do is they're bending forward to touch their feet. And again, if you want to do that just for like a full body stretch, because sometimes it feels good to just stretch everything, that's great. But don't be fooled that you're stretching your hamstring. When you're coming down like this, you're getting some hamstring, but because of the tilt, like I talked about, that bum tuck, like when I was standing, because of that position, you're actually not getting lots in your hamstring to bias it, you're getting a lot in your low back, okay? So don't trick yourself into that. If you want to isolate hamstrings, up high, knee straight, and leading with your chest and your breastbone, okay? But a better stretch that I like, and this is one that I'll show you in a lying down position, but you can also do this in standing by propping your foot up on a step or a stool or something and pressing it down into the stool, or using a strap like this if you've got pretty good balance. But what you're gonna do is lay down on your back with a stretch out strap. A rope or a dog leash also works if you don't have one of these. And you're going to actively, so I'm using this for support, but I'm not pulling with this rope. I'm gonna actively lift my leg up as far as I can. So I'm using my muscles to do that. This is loose. I'm gonna lift up as far as I can. And then I'm gonna hold some tension on this as I press down. So now I'm activating that muscle. Then I'm gonna release the tension and I'm lifting up as high as I can again. And I'm gonna hold that and I'm gonna put some tension on it, okay? Just like this. Okay, alternatively, when I put the tension on, I can bend the knee and kind of bias a little different part of the muscle, but it's the same idea. So that's like an active dynamic stretch where I'm activating the muscle and then I'm pulling it up into the stretch, okay? Now, when we talked about ballistics, what that is that's moving fast through range. So you're gonna have your other leg up to support your back. If you have back issues, I probably would be cautious with this one, or talk to a PT or healthcare provider about it, because if you're not doing it correctly and you already have back issues, it could aggravate some things. You're gonna have this leg up to support you. You're gonna tighten up those tummy muscles, almost like, you know, you're laying here and someone's gonna like drop something on your tummy. So you're nice and stable. Your arms are gonna be up like this. And what you're gonna do is you're gonna kick that leg up to hit your hands. Keeping and you wanna go fast and repetitive, okay? So maybe 10 on one side, come up, and you'll do maybe 10 on the other, okay? And then recheck and see, hey, how far can I get that now? Am I still feeling the same amount of perception of stretch in this hamstring, okay? And then for strengthening, there's so many things you can do. This might be a separate video. You can do hamstring curls if you're in a traditional gym. You can do some bridging. So if your feet are really close to your bum, you're gonna bias more glutes, which is great if that's what you're looking for. But if you wanna bias more hamstrings, you want your feet a bit further away from your bum when you come up. Now, if when you're lifting your hamstrings are cramping, that's a good indication that they are weak and they can benefit from this, okay? So use that as a sign. And if that's happening, you may wanna bring your feet a little bit closer to your bum and then just don't go as high. So you're trying to still think about activating those hamstrings, digging those heels, almost like you're trying to bend your knee, but you can't. So you're digging those heels into the floor and then coming back down again, okay? Alternatively, you can get like a physio ball and you can do a bridge up on here and then do curls in this position. Or say, you know, similar to using the stretch out strap, you can use a TheraBand, and same thing, you're bending and then bringing it back up again. Now for hip flexors, it's the same sort of deal. Most likely you are sitting in a shortened position for too long. When you're sitting for a long period of time, I like you to have a nice curve in your low back, okay? And you should try to get your hips higher than your knees. So in your office chair at work, that might mean some of those chairs can tilt a little bit. Sometimes I get people to get a lumbar support, a low back support to help increase that curve. Alternatively, they can put a little cushion under their bum or sometimes just a rolled up towel. And you want it under those sit bones, not under your thighs, because you're trying to get those hips higher than your knees. It doesn't have to be a crazy angle. Slightly higher is usually enough to help with that. And then the same thing goes for a hip flexor stretch. So if you're doing a hip flexor stretch, a lot of people, they go all the way through like this before they can feel a stretch. And really, if you're looking at my back, that's where this is coming from. It's again, coming all from my back, right? But if I come up and I do a tilt, so it's like the opposite tilt that I was trying to do with the hamstring. So if I do a tilt here, and then I lead forward, driving with my hips versus my low back, now all of a sudden, here I can already feel the stretch, right? Versus before I was way down here and I could barely feel it. So that's something you wanna keep in mind. If you do decide to do like some brief static stretches, but again, I like dynamic stretches. So those ones I like to do, you can lay down on your tummy. I like this because it starts you in a neutral position. If you're starting in another position where you're already flexed forward, you're not getting as much out of it. It's not true hip extension. You end up just moving to neutral. And from here, what you're gonna do is squeeze those butt muscles and lift up, okay? So same thing. You're trying to get past that neutral zone as far as you're able to get, okay? Alternatively, for like the ballistic movements, what you would do is more of like a kick position. So you're standing and you're kicking that leg back. Again, same with the other ballistic, you've got to keep those tummy muscles tight if you need to hold on to something for balance, because I don't want like your whole body, if you're starting to rotate and the whole body's going, you're not getting a stretch of that muscle. Everything's just going with it, right? But if I keep my tummy tight and this leg is stable, now all of a sudden, I'm getting a ballistic stretch in the front here, and it reduces that perception of stretch, okay? So, key takeaways. Static stretching, if you love it, do it, but don't think it's gonna get you necessarily farther than anything else. Dynamic stretching and active stretching is better if you can get it. If these exercises are confusing to you or you want more tips on what that means, send me a message. And then ballistic stretching also. So you're moving quickly through range in order to confuse your body and reduce the perception of stretch that you're feeling. And then, like I said, foam roll or massaging or whatever you can do, it's not gonna make a world of difference. You're not gonna roll out your muscle or roll out your fascia. But if it reduces your perception of stretch and then now you're able to get further with your other exercises, great. Final thing, strengthening. So if you're cramping and if these stretches aren't working and you're still having that perception of stretch, consider a strengthening program for that muscle, okay? And stick with it. Again, we're probably looking at 4 to 6 weeks, but then see where you're at, because that's more likely to reduce that perception of stretch and perception of tightness in the muscle, because the perception of threat or danger in your body just won't be there anymore. Okay, so I hope this helps. Thanks for watching. Let me know if you have any other questions. I'd be happy to help.